We started using that infrastructure to deal with.
Dr. Reynolds Samoa, who recovered from COVID-19, leads the National Pacific Islander COVID response team based in California. The numbers making national headlines are grim.
We found out that in Oregon, they went from the highest to having the second highest rates in Washington State. In 3 out of the 5 counties there, Pacific Islanders have the highest rates of COVID-19. In Arkansas, they have the highest rates. In Illinois, they have the highest rates. In Colorado, they have the highest rates.
The LA Times reported that in LA County, Pacific Islanders suffer the highest infection rate of any racial or ethnic group, more than 2,500 per 100,000 residents.
Pacific Islanders generally have higher rates of uninsured individuals. There's also a high number of essential workers that are in Pacific Islander communities. There's also a high number of us that live in multi-generational homes.
Pacific Islanders also have high rates of heart disease, obesity, diabetes, and asthma. He says there's no overnight remedy, and we can't grow tired of following guidelines.
As Pacific people, we love our families a lot, and we have a strong connection to our communities. So we oftentimes gather in our churches and we gather at homes to celebrate and to console each other. But during this time, those church gatherings and large functions, including funerals and birthday parties and graduation celebrations, if we're not careful, the risk of spreading COVID-19 in that situation is high.
Community organizers across the nation are taking action. Heidi Kenga is with the response team in Southern California.
Our goal is to ensure that we are the data is disaggregated so that we can figure out what our true numbers are when it comes to positive cases, but also to bring light to the health disparities in our community and ensure that we are providing resources from test sites to, PPE.
Kilani Silk, who works with Marshallese Youth, speaks to the alarming figures for Islanders in Arkansas, where there are more cases than in California.
The manpower required in order to properly assist the population is not there. They're currently working on it, and with our website available, we have been getting incoming in regards to interpretation and navigating through the different systems there in Arkansas as far as unemployment, healthcare, food assistance, and policy.
That access largely informed by data that simply isn't available. Richard Chang says fewer than 20 states out of 50 are disaggregating Islander data outside of labels like Asian American and Pacific Islander, or AAPI.
This data will help determine who gets the vaccine first, which communities are going to get testing sites. But even in addition to that, all the resources that will help with the impact of dealing with COVID, such as unemployment or where food banks should be located, all of that depends on the data. And I think as a first step, we should be filling out the census, but we also need to reach out to our representatives and let them know that our data needs to be shared with us.
Data tracker Carla Thomas says there's more behind the numbers.
Because this pandemic is putting those older generations and more chronically ill folks at risk, we're also at risk of losing that vast amount of cultural knowledge and information from our elders. And that's why we have to fight for our communities.
For Guam's News Network, I'm Thomas Manglona.